right. Welcome to the next episode of Mina Studio. I'm glad that you're all here today. We have three really exciting topics to talk to you about today. First, we're going to talk a little bit about self-care and give you some examples from our team of how you can practice self-care. Second, some simple yoga things. Yoga can't be scary, and we want to give you some simple tips about how yoga can be healthy for you, and also how you can practice some yoga in many ways while you're living your life. And third, we're going to talk about heart health with Dr. Brewer. In fact, I see Dr. Brewer on the screen now. Dr. Brewer, could you please introduce yourself?
Hi, my name is Ford Brewer. I have started off as an ER doc, but it became really clear really quickly that after running the umpteenth code on a patient that didn't need to be there, should never have been there, I said, you know what, I need to get into prevention. And sure enough, went to Johns Hopkins. That was the best place to go for it at that time, and have been working on prevention ever since.
Awesome. Well, we look forward to hearing more about kind of what you're going to do for us today in our conversation around heart health. So before we do that, I want to first talk about self-care. So a big philosophy of POPs here is all about you taking care of yourself. And that's what our self-care platform is all about. So we want to give you some examples now of how our POPs employees practice self-care to take better care of themselves. So let's roll the video. All right, so you see some excellent examples there. Some of the people at POPs here and how they practice self-care. And you can see it comes in a wide variety of ranges, from spending time with your kids to walking your dog to exercising. And there is a great number of ways for you to take better care of your total self. And that's what we're going to hear about on the next couple of topics that we're talking about. So before I forgot to mention at the beginning, please, there's a Q&A tab at the bottom of your Zoom screen. And if you're here with us live today, please ask your questions of either myself or of Dr. Brewer. And we'd love to take a little time at the end of this meeting and show the answers to those questions. So one of the ways you can practice self-care is yoga. Now, yoga can be scary to a lot of people, but we have some great tips from Katrina and how you can practice yoga very simply throughout your life and the benefits of it.
Hello Mina Studio, I am Katrina and I'm a Core Power Yoga instructor. I'm usually teaching their Sculpt classes, which is a yoga class that adds on weight and cardio. I know the word yoga scares a lot of people off very quickly and they think it's only for flexible, they don't like meditating, the crazy poses, they're like, I don't even know where to begin. And sometimes yoga does involve crazy poses, but that's usually a very advanced level. And I'm here to tell you, yoga is for everybody, and you can have the benefits of yoga if you're flexible or not. A recent study actually came out that yoga is great for both your cardiovascular health along with many other things, relieving back pain, reducing arthritis symptoms, kind of all over the board, and all the different poses have different benefits. So today I'm going to show you a few poses that you can do in the office to increase productivity, and then a few things you can do at home for self-care to get better sleep, to strengthen your heart, all the things. Okay, we're gonna start with things you can do at the office. I understand most of us won't be going upside down or laying down at the office, so all these exercises you can do from a chair. And the very first one is actually breathing, which sounds like a silly exercise, but it actually can lower your blood pressure, get rid of that brain fog, and just help you refocus to go on with your day. A mindful breathing yoga is an inhale through the nose and an exhale through the mouth. When we inhale, we'll inhale for 2 counts, we'll hold it for 2 counts, and exhale for 4 counts. So we'll do this all together. You inhale for 2, 1, 2, hold it for 2, 1, 2, and exhale for 4, 1, 2, 3, 4. Doing 3 or 4 of these mindful breaths when you are feeling stressed after lunch, really any time of the day will help you refocus and be more productive. The next thing is a seated twist. You'll plant both feet on the ground and pick which way you want to twist. Whatever way you twist, your opposite hand will grab for something, whether that is your knee. This is kind of level 1, I would say. And if this feels good and you could go more, you could reach for the back of your chair. You'll know if it's too much if your breathing becomes very hard or if you hunch over. So when we twist, we want to make sure we're breathing, doing our mindful breaths, and that our spine is very straight. This will help with our digestive system, so it's great to do after lunch. It will also help promote better posture. The last thing that you can do is a seated figure 4. You're going to take your right foot, place your foot on top of your knee, and just sit here for level 1. If you want level 2 or 3, you could push your hand down on your knee. Again, we're going to hold this pose for 3 or 4 mindful breaths. This is level 2. Level 3 would be reaching down to your toe. It opens up those hip flexors that get very tight when we're sitting all day. Also gets our legs moving in kind of a different way to help recirculate blood. Next, we'll go over exercises you can do at home. These are not necessarily more advanced or harder. They're just things you probably won't be doing in the office. First being a standing forward fold. Most people call it touching your toes. So you'll stand with your feet parallel, knees as straight as they can be, and just hang heavy. Hang your arms heavy, let your head hang heavy, and hold it for as long as you can. Our neck holds up our head all day long, and also our head doesn't always get fresh blood. So kind of reversing, letting gravity do its thing really helps our blood flow, alleviates a lot of headaches, neck pain, and back pain. The next thing you can do is feet up the wall. So we probably all did this in gym class growing up and totally forgot about it. You'll sit against the wall, put your feet up, and scoot your bottom as close as you can to the wall, and lay there. Pretty simple. You can play something on your phone, you can scroll through social media, read, close your eyes. This is an awesome exercise and actually helps you sleep better. So if you're kind of getting that restless night's sleep, try doing this before brushing your teeth. And then the last thing is adding weights throughout my day. Sometimes I know I don't have time for a full workout, so I have got these wrist weights. It's kind of hard to say. These ones are ball bands. They're just 1-2 pounds. And so I'll strap them on before I clean my room, I do laundry. It just adds a little bit of that weightless lifting aspect. If I don't have time to work out, weightlifting is so beneficial. It really gets your heart pumping. It's honestly one of the best things that you can do. I'm not a huge heavy weightlifter, so this is perfect for me. I'll strap these on, do a few things around the house, maybe try to raise my hands up for a few times and down slowly. Just getting a little bit of exercise wherever I can. I hope these tips help, and I hope you have a great rest of your day. Thanks, Mina, Studio, and Pops.
Thank you, Katrina. Great tips that all of us could use. I use that breathing one personally all the time to try to lower my blood pressure. So I didn't mention that I'm standing in today. I'm Lonnie Stormo, CEO of Pops. Our normal host of Mina Studio, Stephanie, didn't feel good today, and she needed to take some time for herself. But that gives me the chance to talk about our self-care platform. One of the things that is so exciting to me here is how we continue to build out the self-care platform and add more and more solutions to you, our owners, the people that are using Pops. We have Mina at the center, as you know, and then we have an ecosystem around Mina that is all designed to make it easier for you to take care of yourself. People like me with diabetes, we want things easy. And how do we do that? With our partners. So I'd love to share with you some new partners in our ecosystem. And you've already heard a couple of these names. So first off, in our partner, Chef Marshall O'Brien Group. You've seen Chef Marshall at Mina Studio before. We've had some Facebook Live events with them. Marshall's a great guy, and part of how he is helping you is to nourish to thrive. Don't just eat to survive. And I think that's a great way of thinking about how we should be eating. Boo Vitamin, Dr. Leviton was at our last Mina Studio and talked about how vitamins can help you in your fight against your diabetes. And today I'm proud to announce I'm Aware. I'm Aware is basically about helping you get more lab tests like your A1C done right at home. And Dr. Brewer is actually representing I'm Aware today. And that gives me a great chance to kind of bring Dr. Brewer back in here and let him talk a little bit about heart health.
So thank you so much, Lonnie. Let me go. I just had a brief couple of slides that I wanted to show the group. Points. CDC says 84 million, or 1 out of 3 starting age 60 and above. 90% that have it don't know it. Actually, much more comprehensive information, much newer information. Multiple studies indicate this problem is not starting when you're 60 years old. This problem is starting when we're 30 years old. And again, so you see a lot of alarmist information out there. By the way, before we get into whether it's alarmist or not, if you've had bleeding when you go to the dentist, you're very likely to have this problem too. So now, before we talk a little bit more about the whether, again, there's alarm there, let's ask the question, well, where are the doctors here? Are you saying my doctor doesn't know how to diagnose this or treat it? Unfortunately, yes. I'm not saying that. If you look at the science, this is just one of many articles which show that doctors, your primary care doctors, are not equipped to handle this issue. This is another one, it's from Johns Hopkins. And basically what they're saying is about 2/3 of docs really don't know how to even diagnose prediabetes, let alone how to treat it. So another thing to think about is this. Well, I know my doctor mentioned that I've got a little touch of sugar, but he said, don't worry about it. We would just keep an eye on it. And I just put a little bit less sugar in my coffee in the morning. That's not the reaction we want. We'd much rather understand the situation a lot better. Again, because terms like insulin resistance, a touch of sugar, prediabetes, metabolic syndrome, all these terms indicate you may have damage going on. CDC would say, yep, you've got damage in terms of risk for prediabetes, heart disease, and stroke. Someone's already mentioned heart disease. The real issue with diabetes and prediabetes is heart disease, cardiovascular disease. Some folks have said, yes, this is way too alarmist. Again, this is a pre-diagnosis. It's not a real disease. It doesn't cause damage. Let me just clarify something. If you look at the science, you look at the studies out there, this is one of them. between 1 and 2/3 of people, by the time they get a diagnosis of diabetes, already have nerve damage. Same thing with retinopathy or damage to the eyes. So, yep, you do get damage if you get this problem, if you have this problem and you ignore it. Where can it cause problems? Well, let's go through it real quick. In the brain, it's the number one cause of stroke, number one cause of dementia. In the heart, number one cause of heart attack, number one cause of heart failure. The kidneys, number one cause of kidney failure, and eyes, number one cause of blindness. I mentioned a few minutes ago a little quick item about bleeding when you go to the dentist and gum disease. So if I have just a touch of sugar, I'm okay, right? And like my doc said, we'll just keep an eye on it. No, learn a little bit more. Groups like I'm Aware have developed great systems to start testing and to give you a clear understanding of just how much risk you have. Because here's the thing, people will say a generation in jeopardy, alarmist and things like that. It's not an alarm, it's an opportunity, because if you do the right things, some of which we're talking about on the show today, you can take the risks associated with diabetes and prediabetes completely off the table for you and your family. Let me just say it one more time. It's not an alarm, it's an opportunity, because once you recognize what you have, you can take these risks off the table for you.
Awesome. Thank you for that. Really, really appreciate it. And, what we really want to do now is a couple of things. One is, I see Yanni Toomey joined us. Welcome, Yanni. And Yanni is the founder and CEO of I'm Aware. And Yanni, maybe you could tell us a little bit about kind of why I'm Aware and what can I'm Aware do for people with diabetes?
Absolutely. Well, pleasure to be here with you, Lonnie, and congrats on everything you're doing to help people identify and manage diabetes. So I'm Aware got started over 5 years ago to help people screen for conditions that, they may not be aware of. And so prediabetes was very much one of those conditions, especially the numbers it afflicts, as we know, is rather large. And then by the time people realize they have it, it's been, kind of running rampant a little bit inside their bodies, as we've heard from Dr. Brewer. And then all of a sudden we have to sort of aggressively go after it. So being able to just run an at-home test that's generally affordable, to get in front of this, to get to your doctor sooner, to be in front of life changes, dietary and lifestyle, is exactly what we're about. And so empowering the patient, bringing awareness, letting patients have their moments where they say, I'm aware, is what we're all about.
Yeah, that's a fantastic description. And I just my own personal story. So this week, actually, I went to my endocrinologist for my diabetes, and I was waking up and fasting in the morning. I had to skip my exercise because I was fasting, waiting until I went to my lab appointment. And as a contrast to that, I actually have done the heart health test from I'm Aware, and it was fantastic to just be able to wake up in the morning, do my test and then send it in the mail, and I didn't have to worry about any of the rest of that. So there's a super convenience to I'm Aware and what you guys allow people to do right in their home, as opposed to having to go to the clinic and do it. So thank you for developing this type of solution.
Thank you.
Yeah. So Dr. Brewer, were you going to say something, Dr. Brewer? We have about 5 minutes here for question and answer, and I got a couple of questions, but go ahead, Dr. Brewer, if you had something to say.
Just a comment. One of the bigger challenges with me and getting patients in to get this diagnosis is it's a headache. I got to set an appointment at the lab. I got to go out there. It takes my whole day. It takes 2 or 3 hours. And now with I'm Aware testing, you really don't have that impediment anymore, that block. It's really
I totally agree with that. And it is a very easy thing to do right in your homes. And I would encourage you all to try it and to get your A1C, to get your cholesterol, your lipids, and any other thing tested that really can be helpful to you. So Dr. Brewer, a question for you. We all need carbohydrates. We all need sugar to a certain extent to live. When does too many carbohydrates start to cause what you called inflammation, and why does that happen?
So here's the thing, Lonnie. As many people think that we have to have carbohydrates, the reality is that we don't. If you look at, there are some populations, for example, the Inuits, or people call them Eskimos. The Eskimo populations have lived on solid meat for generation after generation and still had no heart disease. So there's a lot of things that we don't fully understand about diet and heart disease. It may sound like from the comment I just made that I'm a dyed in the wool keto guy. I'm not. I'm comfortable with just about any type of diet that my patient brings to me. But here's the critical piece. It's not so much whether it's low carb, low fat, paleo, keto, vegan, any of those. Just so you know, does my body metabolize carbohydrates? If I eat carbohydrates, does it damage my arteries? And again, it's very simple now to figure out the answer to that. Now, the American Diabetes Association used to be very strong on saying that you have to have, gosh, what was it? A very large amount of carbs in their diet. They've just recently, over the past year or so, begun to back up on that and say, no, low carb diets do work. So again, I'm not going to get into the debate about which diet, but I will say, know whether or not carbs hurt you. And this testing can help you do that.
So when you have a patient that shows a touch of sugar or phrases like you were saying, what's the number one thing you tell them to do to try to change that direction?
So it's diet. It's
Okay.
Take a look and see, okay, what are you putting in your body? The second thing is body fat, because something we haven't known for a long time, we always thought that body fat was just an inert energy storage tissue. It's not. It's an endocrine tissue that drives this. So the biggest drivers of this problem are age. People don't know that. Many people think the obesity epidemic is driving it. Obesity is important, but age is the number one driver. You can't reverse age, but you can do something about obesity.
Wonderful.
The two other critical points that you see over and over in POP's content is, number one, exercise, and number two, knowing what your blood sugar is doing.
Yes, and to that last point, so clearly POPs can be helpful if you're actually using POPs at that point in time. Mina is one great way to get connected to solutions like I'm Aware, et cetera, but also you mentioned diet. The reason that Chef Marshall Group is one of our partners, they talk about nourish to thrive, not just to survive. And we have some other exciting partners coming up in the near future here, which are going to help people eat more healthily and try to reverse that. Last question for you, Yanni. So if somebody wants to order, somebody with diabetes, somebody with prediabetes, somebody that's using the POP solution wants to order something from I'm Aware, what is the best test they should pick as kind of a first way to kind of look at kind of where they're at today?
That's so I'll give you the I'm Aware answer, but I'm not a doctor. So let's just make sure I refer to my doctor friend on my left here. One thing we've said a lot of is there's a lot of people who have never checked their basic heart markers. So do they know their A1C? Do they know their triglycerides? Do they know their lipids or inflammation? We make that really easy in one test called the baseline heart health test. We've come across patients who have been 40 plus and have never had a reading like that. So our recommendation is, of course, if you've got insurance or you got a doctor or you can get a test, please do get that test, baseline yourself. If you don't have that availability or it's too expensive, I'm Aware offers an alternative for you. That's certainly a test that we have a lot of people buying to be able to set some type of baseline. And I'd love to hear Dr. Brewer's thoughts, because it's probably better to baseline a little earlier in age so you kind of know where good numbers are. And then over time, if they start creeping up, you know that you kind of got to get them back under control. So our stance is baselining sometime earlier in your life is better than later. Dr. Brewer?
Thanks, Yanni. I would say absolutely no question. I get patients come into me and they start realizing this is something I wish I had done in my 20s. But guess what? I've got a 24-year-old son and a 6-year-old daughter, and they'll get their kids tested. And quite often we'll see problems. We'll find them that early. It's so much better to find a problem early because you don't get the 3 or 4 decades worth of damage before you get there.
Yeah.
Wonderful. And
Well, let me
Dr.
say
Brewer, you
one
get the
thing.
last word on that. Thank you very much. So as you're leaving, if you're live here with us today, you're going to see a little survey pop up as you get onto your Zoom. Please answer the questions on that and tell us what you want to see on Mina Studio or what things that we can do for you to help you manage your diabetes better. Thanks, everybody. Have a good day.